Representative Patti Bellock, thanks for joining us on the Illinois channel. We wanted to kind of get an update on what's happening with the Medicaid program. Now, that's a federal program, but it's carried out at the state level. And about 2 years ago, I believe it was the spring of 2012, you were involved in one of the major issues that year, which was the reduction of Medicaid spending, which was heralded as a great breakthrough, and there was a lot of work going into that. And yet today we find ourselves here in 2014 looking at now a major expansion of Medicaid. Can you give us an overview and try to make some sense of that for us?
That's hard to do. Anyways, yes, the governor asked us, I think it was 2 years ago, to move forward and cut $2.6 billion out of Medicaid. So he created the LMAC committee, of which I was one of the co-chairs, and we worked almost 6 months straight, and towards the end, almost 3 to 4 days a week, trying to come up with, we came up with $1.6 billion cuts on 62 programs in the Medicaid program, which was a pretty heart-wrenching experience, because the bottom line is that we want to sustain the Medicaid system for the low-income, poverty net that we want to make sure have their health care services in the state of Illinois. The way the program was going with, at the time, I think we had $9 billion in unpaid bills, none providers. It was 6 to 9 months that providers were getting delayed in payments. Some of them were going out of business. So that's what we were trying to address to sustain the system of Medicaid in Illinois. We were successful at doing that, and we moved forward with that. And really, I've been in the legislature quite a long time, and I have never seen a bipartisan group work so hard to try to protect the group that we wanted to provide the services for, and at the same time address the issues of sustaining the system in Illinois. Now what you had the next year was you had the Affordable Care Act come forward, and in the Affordable Care Act was a major expansion of Medicaid. So then we started to address that issue, and those of us that had worked so hard to make the cuts and to reduce the system and still provide good access to care and good quality to care, found ourselves saying, okay, you're going to now expand the system to maybe 500,000 people, 700,000 people, and maybe with the woodwork population, even 1 million people into Illinois. Now, it was supposed to be, the match was supposed to be 100% on the newly eligible.
Let me break this up for just a minute, because do we know before, and the Affordable Care Act is also referred to as Obamacare,
right,
so people might hear. So, do we know before the implementation of the Affordable Care Act, how many people are on Medicaid currently in rough numbers?
In Illinois, we knew we have we have 2.9 million, almost 3 million people on Medicaid, and that was our concern. You have now.
Well, I just want,
yes.
But just to lay out the basics.
Sure.
So roughly $3 million. So when you're talking about 500,000 or 750,000, again, that would be an expansion of beyond those numbers.
Absolutely.
Now, and again, of course, just not to make your case for you,
No.
but when you're cutting back, as we so often hear, people will make allegations that you're thoughtless and don't care
Right.
about the poor
Right.
and all that.
Right.
You were looking, not only you specifically, but those who were looking to cut back was because, look, the state has limited funds, and the point was to save the program from imploding because it had all kinds of financial problems.
Mm-hmm.
Now, let's come to the current level. So the president's coming along and he wants to expand the rolls, and that might add 500 to 700,000. It's somewhat of a projection, you don't know.
Right.
The federal government had says, under the way it was advertised, the headline is that for the first 3 years of his program, the feds would pay the states 100% of the coverage, and then it goes down to a 90% compensation.
Right.
With that understanding, you're saying tain't necessarily so, that there's going to be other costs that weren't in the headline that would cost the state of Illinois dearly. So with that set up, let's go into that. And you used the term woodwork. I don't know that people know what do we mean by that, and where are these other costs that could really have a negative impact on the state since we're already basically insolvent?
Sure. Well, that's what we were talking about, is that in the expansion, when the Affordable Care Act allowed that, just to back up a little bit, we thought we were going to be forced to do that, okay? And so Then what happened was when the Affordable Care Act was challenged, the only thing they took out of it was the Medicaid expansion, and they allowed the states to vote on that themselves. So that brought it forward to us for a vote, and we worked very hard against that just because we were afraid of the costs. So there's where we are now. It passed, and now the Affordable Care Act is in full motion now. So what we said at the time was you might have 500,000 or 700,000 new coming in, but because there's so much advertisement of the new eligibility of Medicaid at 100%, it brings out what the Kaiser Foundation called and the feds call the woodwork population. Those are the people who may have been around and didn't realize that they were eligible for Medicaid, but only at the old match. So now you may have 300,000 new people coming in, but only at a 50% matchable rate. If that would happen over a 6-year period, and when the other ratchets down, that could be a total of $3 billion in additional costs to the state of Illinois, and that's what we were concerned about. And recently, I read of the new influx of a huge, almost 100,000 coming in last week, or this month, and the notation was a lot were coming in at the old rate, which is what we were afraid of, because then we have to pay. Something else that they wouldn't give us a cost on was the administrative costs of all this. Now you have what you call the navigators that are supposed to be federally matched, but now you have what's called an in-house counselor, which is supposed to be state matched. We have absolutely no idea of what the costs are of the in-house counselors.
Are those mandated, or is that an optional?
It's mandated, and now somebody told me we're trying to find out more information about that, but everything is rolling in so fast. And then remember, the cornerstone of the Medicaid reforms was the Maximus contract, and now that has been thrown out the window except for a little bit.
Let's remind people, so Maximus was a firm that came in and said, we're going to go through the Medicaid rules to see if there are any people on the Medicaid rules, which is a program, again, for the indigent health care. Are there any people on there getting benefits that aren't, should not be getting? Maybe their income's too high or whatever. And what they found out was astounding. What did they find, their initial findings? I think they took 20,000 people and looked at who were getting the benefits?
Oh, of the first grouping, the figures were stunning. It was almost like 60% came off. And those
60% should not, who were getting benefits should not have been getting.
Of the first grouping that they reviewed. And we knew that that would be what they call the low-hanging fruit. But still, almost everybody in that lived in Michigan, Indiana, Iowa, or Wisconsin. They didn't even live in our state, and they were on our Medicaid rolls. So those were some of the things. And then, but moving forward, as to, we thought that in just that program alone, our forecast was to save $350 million, because we figured that close to 300,000 people would probably come off the rolls in that process. And moving forward, they got a slow start, but within 6 months, they were taking off 1 out of every 5 people that was on the rolls. And then that's when it was stopped. So. And
why was it stopped? It sounds like if they're saving the state millions of dollars, why would we stop that?
Well, that's a good question. And one of the unions said that there was a problem, that they thought that the act said it was just, it may happen, this process, not shall. And so they went and filed a grievance, and the arbitrator ruled in favor of them. Then we asked the governor to file an appeal to that decision, of which he did file an appeal, but then he settled with the unions and he with the arbitrator. And so what they said is they were going to cut back the process that Maximus was using, and that only the DHS workers would do most of that enrollment work. And our claim was that they could have done that to begin with for years, but had never been doing it. And that's why we suggested an outside vendor. So now we feel we're back to square one on that issue, which was the cornerstone of the reforms.
So where we're standing now, and the Illinois Channel just recently did an interview with Dan Long of COCFA, the Government Forecasting and Accountability. His concern, for our viewers' benefit, was that we have the increase in the income tax going off in January of 2015, unless it's extended. Right. That will cost the state some billions of dollars. Right. At the same time that, as you just laid out, we are going to be, as a state, incurring $3 billion, maybe more a year, while we're losing $3 to $4 billion on the income tax. Mm-hmm. And here we are already not paying our bills, and we're looking at incurring there collectively somewhere between $6 to $7 billion more a year in costs. What
That's
is
a lot
this?
of
Is this?
billion dollars. I'm
It's a
not
lot of
sure all of
billions.
that was accurate, but the point is that we were moving forward in a bipartisan fashion in trying to save the state money and to keep a program that we want to sustain in Illinois. Now facing the income tax going away, we could have taken more of those people off the rolls and sustained the system and still saved on money and provided still better quality care and better quality access to health care. So now I feel like we're at a stalemate on that, and yet now we're still taking in more people from the Affordable Care Act coming in, and the county care program that came in. They have a huge influx of people, and so they're behind in their match payments because they're using the DHS worker, and they are stretched to their limits.
So, and again, as far as saving the program, it's because currently, I mean, it's not like doctors are forced to be participating in Medicaid. They can drop out. And I guess any of our viewers would say, if you were working for someone that was going to be paying you, but paying you 6 or 7 months after you did the work, you may opt to leave that business. And this is basically what the state is doing to doctors who perform Medicaid services, right?
Mm-hmm.
The hospitals are incurring those costs by putting Band-Aids and treatment and tests on these people,
Right.
but waiting 6 to 7 months to be compensated. And even then, isn't it just a small percentage of the overall bill?
Oh, yeah, it's very minute. In fact, a lot of doctors that do it almost would prefer just to do it for charity reasons because the paperwork is hardly worth what it is. Now, in the Affordable Care Act, they did increase that rate for doctors Medicaid, but really not that much. So any doctors out there that provide Medicaid services are really doing a great job for the people that need that. So that's the problem. And moving forward with the Affordable Care Act, it could be 17 million people across the United States onto the Medicaid expansion. 17 million people throughout the states. This is a huge expense, but also a huge thing in where are you going to get the medical professionals to be able to provide those services, especially when they're given such a low rate.
And these are Medicaid and Medicare, but Medicaid, let's stay with that, is part of what we call the entitlement programs
Right.
at the federal level, which are grossly underfunded
Oh, absolutely.
and heading for bankruptcy. So
Right.
now we're, in effect, exacerbating, speeding up the date at which time they're going to go bankrupt. Right?
Right, and something interesting about that I mentioned when I debated the Medicaid expansion on the floor was the point that we were worried that when they got to the debt ceiling talks, they would take that 100% match back down to 86%, which is what President Obama had in his budget the previous 2 years before. So with Pat Ryan and all those people up there doing the debt ceiling talks, we weren't sure what was going to happen. So that was part of the problem, the uncertainty of all the numbers here. And this is the biggest health care change in Illinois right now. You had the Medicaid, the SMART Act, the reforms, then you had the Medicaid expansion, then you had the Affordable Care Act come in with all those provisions, and now you have the talk with the governor of the 1115 waiver, which would be another major change. It would change the entire Medicaid system in Illinois. So it's hard to keep track of everything that's going on. You almost need a college degree, but we're trying to hang in there, and our bottom line is we want to sustain the Medicaid system, but the numbers in the expansion, and they're coming in now higher and higher, and not only are we able to afford it, it doesn't seem like we have the amount of personnel to address the enrollments and to make sure that the enrollments are for people who are eligible for the system.
You know, forgive me for using this, but I mean, it sounds like a major train wreck coming.
Yeah. Well, you know what happened with the Affordable Care Act, with the enrollments and everything? It was planned very shortly when it got rolled out. And that's what we see happening here. We've, trying to talk to the people that are in the agencies about what's going on, and right now in my local DHS office, there are 2,500 people to every case manager. The line is 1,000 people out the door to get services. That is before the expansion has taken place.
At what point, I mean, you're one lawmaker, but when you meet with your fellow lawmakers, is there agreement across the aisle? I mean, is this a partisan thing? Because it seems like people would just say, what are we doing here? And how are we actually going to manage this? Because it just seems, as you just illustrated, an impossibility. If you already have one caseworker to 2,500 recipients, and if that goes to 3,000 or
Right.
4,000,
Right.
it's just obviously unmanageable.
Right. And so that's where we're at right now. All I can tell you is that we're trying to address those issues. I, as a lawmaker, was terribly frustrated by the change in the Maximus contract because we felt like we didn't even feel like it was taking off. I mean, when you're taking off people that are out of state, it's not even like you're taking out any of the people from Illinois, And if people legitimately belong on the rolls, all they had to do was to attest to what their eligibility was, and they would be kept on the rolls. Illinois had something called passive redetermination that the Auditor General said should be eliminated because people that got on...
And what is it?
What it was if you were on the rolls, they would just send you a letter a year later and say, do you still match your eligibility? Well, a lot of people don't want to get off the rolls, so they would never send back the letter, so they would just stay on. So the SMART Act took the passive redetermination off. Now, across the United States right now, they are so far behind in the Affordable Care Act with the Medicaid expansion. They are now doing what we tried the opposite to do. They are saying what is a shortcut. They are allowing people to self-attest to what their assets and income are and just go on the rolls. Illinois is not doing that. Our Director Hamos insisted that we would not do that in Illinois.
And just, I mean, this is obviously almost something we could talk about for an hour. I won't hold you up, but people are going to hear that and go, well, how is it possible that people from Iowa or Michigan could get on there? Is it a failure that do we not ask for any documentation of where they live? Or how is that possible?
I think in the majority of cases, those people may have lived in Illinois at one point, and because of this passive redetermination, they had just been kept on the rolls. And so certainly, you would just want to stay on the rolls if nobody's checking, And they may have kept a post office box in Illinois, and I'm not sure exactly how that happened, but that was what was told to us to begin with. And then they went into some of the others. But a lot of the Medicaid fraud, what we're looking at now also is a large part of Medicaid fraud is by providers, and that is something that we really didn't address that much when we did that. And so moving forward, I have some people that we're looking into working with. In fact, the state police, the Illinois State Police, has a Medicaid, Medicare fraud task force that is working all the time. And so we've been talking to them about issues of, how to raise awareness of people who really do abuse the system, whether they're providers or just plain recipients, that they're accountable for that.
And we'll close with this, I guess. I would say to those viewers who might think, well, I'm not on Medicaid, it doesn't impact me. I will point out, I know there's just one hospital a few years ago in the Chicagoland area that had to eat $50 million, just that one hospital, because they were having kids coming over from Indiana. When we have our hospitals and our providers so burdened financially,
Right.
that medical infrastructure that we think is there
Right.
is going to be stretched to maybe to the breaking point, and that's going to be a breaking point that impacts everyone if we're needing to go use those facilities.
Oh, absolutely. That's why, it's like everybody in Illinois pays for the Medicaid system, even though it's a federal match. It's just like when your federal taxes pay for things, people say, well, that's the feds. Well, that's your tax dollars too. So that's why we're trying to have the tax dollars go in the right direction to help the people who need that the most. And it's going to be interesting this year to see what happens. And, all our main focus is that the system does not implode, that we get enough medical providers, and that we, have the system stay in place with good quality health care and access to care.
Well, Representative Patti Bellock, I'm fighting from asking you 15 more questions, but we'll maybe do this again and update us. But thank you for joining us.
Well, thank you for having me. I really appreciate it. Thank you.
You're watching the Illinois Channel.